And just in terms of integrative, I want to highlight that your book is just beautifully integrative. You have brought in the neuroscience, the clinical phenomena, the non-clinical, ways that this gets represented, the individual, the relational, the group, the societal, the collective. You in such clear language and with lots of great examples, make this clear to people, much more than I could do. That's one of the reasons I probably went off in the more training program for clinicians development. But this book is unprecedented. It's definitely going to make a huge impact, not just in the field of attachment, but I think in the society at large.
Welcome to Therapist Uncensored. Building on decades of professional experience, this podcast tackles neurobiology, modern attachment, and more in an honest way that's helpful in healing humans. Your session begins now with Dr. Ann Kelly and Sue Marriott.
We were just looking, and it's been 200 episodes ago exactly that we started our relationship with you.
200 episodes. Wow.
I love that you remembered that. We were just sitting here talking about it's been a while, and your episode 234 and our first episode you remembered was 34.
Yeah, I had a vague recollection. 34 sounds familiar. So
that is so fun.
A lot has happened during that time.
Well, one of the things that's happened is we've built a really solid friendship that's carried through the years and working relationship, which I think has been really powerful.
Yeah, the best of both friendship and collegial professional relationship as well.
And just as a reminder, and again, our longtime listeners will be very familiar with this, but that I had gotten obsessed with your book and had it torn to shreds from like my dog ears and notes, and literally the cover came off. It's not often that I do that. And so we hunted you down, and that was the beginning. We also brought you to Austin, Texas. This is how crazy we are about David Elliott's work. Brought him to Austin, Texas to do a in-person conference. That's the only one, besides the one that's coming up next week, that we're presenting. Other than that, that's the only conference that Therapist Uncensored has sponsored. So you're very special to us.
For those that aren't familiar with you, David Elliott, tell us about your book, like the book that she's talking about, she dog-eared.
Yeah, it was wonderful, Sue, that you were the first biggest fan, passionately enthusiastic about the work, and it was great just experiencing that from you shortly after it was published. So eternally grateful for that. Yeah, the book, I'm a co-author of the book. It was Daniel Brown, the senior author, who you've also interviewed on Therapist Uncensored. Unfortunately, he died just 2 years ago, in April of 2022. So he's the inspiration and the originator of the principles that underlie the 3 pillars attachment repair work. And we published the book called Attachment Disturbances in Adults, Treatment for Comprehensive Repair. And it came out in 2016. And it's a big book, 752 pages. I often recommend people buy 2 copies because you can get a bilateral workout with them. The first half of the book covers the history in the field and what's known and understood about attachment, its formation, its manifestations, its problematic and non-problematic forms. And there's a whole lot there. Obviously the field of attachment is full of wonderful research and researchers and information, some of which is conflicting, some of which is controversial, but that just means the field is alive and there's room for lots of people to offer ideas and to evolve the field further. So we hope and feel that this book and the work that it describes have evolved the field further, particularly in the domain of treatment. So treatment for comprehensive repair is the subtitle of it. And that's based on what we, Dan and I, and 7 other colleagues who contributed in various ways to the work, to the book, recognized as a limitation in the field. A whole lot known about attachment dynamics and its formation, but not a whole lot written about treatment. The primary treatment model, which I still believe is very valid and is fundamental to effective treatment for attachment insecurity, the more clinically significant forms of insecurity, is what I call the therapist as good attachment figure model. And the principle is that when somebody comes into therapy with internal working models of insecure attachment dynamics. Basically, if during their childhood they experienced caregivers who were not reliably available to attend to the needs in a reasonable way when they arose. And in worst case scenarios, if those caregivers perhaps were scaregivers, were neglectful or abusive or both, then they'll have an internal working model, basically an internal representation of how relationships are expected to be in their adult lives. So if I had a neglectful parent as a child, well, if I get into a close relationship in my adult life, I'll expect to be neglected. It's not just a conscious thought about that, although that may be there too. But most significantly, there's an unconscious expectation that leads me to expect neglect, that leads me to see neglect perhaps where there isn't any, to project that onto the other. And that obviously creates problems for the relationship, for this, and for the self. So the idea of therapist as good attachment figure is that in therapy, the therapist aims to be a good attachment figure, to provide what's been termed a corrective emotional experience, to help the adult client or patient feel seen and valued and be able to have some trust that the therapist will be available and reliable and attuned and provide soothing when the person's upset, among other characteristics and features. The principle is that when that happens over time, the old internal working model gets replaced by a new internal working model, and hopefully a secure internal working model, which then changes the set of expectations the person will have in their relational life from then on.
It sounds like you're leading up to a healthy criticism of that one approach. It's very exciting.
You're right, Sue, to have heard that I was moving toward a criticism, and I see it as a constructive criticism, because as I've said, we still have as a foundation in our 3 pillars model for attachment repair, a foundation is the therapist as good attachment figure. But we feel that's not sufficient for many of the patients or clients that we see. One of the principles that underlie that limitation is that the original internal working models were formed during childhood based on the person's experience as a child having an ongoing relationship with an adult, the caregiver or caregivers. So in therapy, therapists can be a great attachment figure that can get internalized, that creates an internal working model of the adult client with the adult therapist, right? And that internal working model is a good one. But the internal working model of the self as child with an adult caregiver can then still coexist, because they're 2 different kinds of relationships.
Well, so you're saying that when all goes well, the client gets better in the sense of they've had this new experience, they attach to the therapist is the safe figure, but that it doesn't necessarily translate into shifting. So when you're out in the world and you're in attachment and distress related to relational distress, that early wiring is still going to be there when the therapist is away, when it's new people, when it's not the same safe object, safe person.
And I think that explains why, though the therapist as good attachment figure, TAGAF model, has been the prominent model for many decades, the basic principles were described by John Bowlby, brilliantly. And again, this is an important foundation. But therapists who've had any ongoing experience working with people with attachment problems often feel frustrated that it can take a very, very long time. And the repair, the manifestation of security can be elusive for many people. And I think that this principle that we're touching on here is a central principle of why that is. We create a new internal working model, which is great, and that's going to provide benefit for the client. But it's a different internal working model, a different category of internal working model. So the old one continues.
Right. So it also makes me think of somatic therapists and folks that, right now people are very interested in the body and bottom up healing. But I think you would also say that also by itself is incomplete. Is that right?
We see our approach as an integrative model. And in fact, we're calling it now integrative attachment therapy. And it's very important to me to appreciate and respect what every mode of therapy offers. It's kind of like the blind men and the elephant. Depending on where you look, you're going to see something different. And whatever you see is valid, depending on what you're looking at and how you're with it. So the somatic work is really, really valuable and really important for attachment repair work, partly and largely because during the period when initial attachment representations were formed, basically toward the end of the first year through the second year, the body was central to experience. The narrative cognitive memory system as an operating system was not so operative during the formation of the internal working models, but the body was the center of experience, of processing information, of memory. And this is one of the brilliancies of all the somatic work, the somatic experiencing and sensory motor psychotherapy and other bodily focused work. That helps the therapeutic process get to those very, very early places. Now, again, that's really valuable for attachment repair work, but we want to include that as a component and not rely on that exclusively. So you mentioned bottom up and top down, and that different modes of therapeutic process could be seen as either more bottom up oriented or more top down oriented. So the somatic oriented work, that's more bottom up. And it's really valuable. It's really beneficial for many, many people. And that's why many clinicians swear by it and find it tremendously useful. Now, there are also various top-down approaches. Of course, cognitive behavior therapy is a primary one. But in the domain of attachment, one mode of more top-down oriented therapy is mentalization-based therapy, the work of Alan Bateman and Peter Fonagy and John Allen, where they focus a lot on the fact that particularly people with personality disorders, such as borderline personality, if you accept that diagnosis, they quite often have insecure attachment. Roughly 90%, the research shows, of people with borderline personality disorder have some form of attachment insecurity in a problematic way. Peter Fonagy and his colleagues have recognized that in addition to that attachment insecurity, people with personality disorders also have very limited abilities or impaired abilities at mentalization, which is essentially the reflective function. There's different terms for it. We refer to it as metacognition, mind sight. Yeah, there's different terms for the same domain of phenomena. And essentially, all those terms refer to different forms of perspective taking, the capacity to recognize that what's in the mind is in the mind, to recognize that whatever our experience is, it's being constructed in various ways by our mood states, by our biases, our tendencies, by our attachment pattern activation. I think your most recent episode of this podcast looks at the sunglasses. So to be able to recognize that I'm wearing sunglasses, with a red tinge or with a blue tinge at any given time, that's mentalization, that's mind sight, that's metacognitive capacity. And so given the limitations of that capacity in people with attachment insecurity, Peter Fonagy and his colleagues say that a focus on that is really, really valuable for treatment. And I agree. It's really, really valuable for treatment. And I don't think that it is sufficient for fully resolving attachment insecurity. The conditions that create attachment insecurity during childhood also create limitations in mentalization, in reflective function. So if we are working with an adult with attachment insecurity, we're going to see signs of that insecurity, and we're going to see signs of reduced reflective function and mentalization. So if we go into the therapy process and just increase mentalization ability, reflective function ability, a person can come out of the therapy process with really good reflective capacity, but still be insecure in terms of the insecure working models. people who've been in psychoanalysis for many years, they develop really good reflective function generally, because psychoanalytic process is all about looking inward and recognizing what's there and developing insight about patterns and connections within the psyche and in how that relates to relationships. So a great amount of understanding develops, but the internal working models can still be insecure. So in this approach that what we call the three pillars work, we have metacognitive enhancement as one of the three pillars. We have as another of the three pillars enhancement of collaborative ability, the ability of a person to engage with others in mutually beneficial ways, basically to orient toward a shared task where it's recognized by everybody involved that each person has something valuable to contribute. Each person has something to offer, including the self. People with insecure attachment, because of the conditions that created that, tend to have limited or problems with collaborative ability as well.
If we talk specifically about collaboration, I think that's a really great concept if we could unpack that a little bit, right? Like somebody who has more of a preoccupied or anxious attachment, their difficulty collaborating is often difficulty holding themselves as valuable enough or trusting somebody else enough to be able to engage with them, right? So offering them the collaborativeness could be difficult. Go ahead, Sue.
Yeah, I was thinking that earlier. It's like an example of the difficulty collaborating can be as simple as someone who has tended to be, in our language, trends blue, is a little bit more zipped up, has internalized messages that they're on their own and that they shouldn't be vulnerable or trust or turn to folks so much as the general guiding principle. So let's say they're in therapy. The idea of collaboration with them is even just getting them to share information, helping them learn what to talk about, helping somebody who's over on the red side, perhaps. I love, David, in your book, you talk about this, and I've done some of the course, and I know that you'll get there, but around moving the focus of attention from the outside to the inside with somebody that leans red, that if they're always poking it outward, she did this and they did that to me and this and that and the story and the story and the story, that's an example, I think you would say, of unconscious, unintentional, non-collaborative behavior. So the process of getting them into the therapeutic frame, I love, Anne, what you said about like just that idea of collaboration is a really big concept. So is that kind of what you mean as like examples of these subtle ways that we can be non-collaborative?
Those are good examples. And another that comes to mind is, say, somebody with a more anxious, preoccupied pattern, or when that's manifesting in the therapy, might be really focused on the therapist. And it's like wanting to please the therapist. Oh, well, is that what you're looking for? Or,
So they think they're collaborating.
Right. They think they're collaborating. Yeah. And partially they may be. They're willing to receive what the therapist is offering, to pay attention. But they're underappreciating their own value, their own contribution to the therapy process. So in order to support collaboration, if that's going on, I might say something like, I noticed that you're really looking to me for guidance a lot. And, that makes sense because, the therapist role is often seen as someone who can offer guidance. But I'm a little concerned that you don't seem to be valuing yourself and what you're bringing to this process of the therapy together. So what are you experiencing right now? What's happening inside you? Oh, I don't really know. I guess I'm really worried that you're going to judge me.
Yeah. Now I feel in trouble.
Yeah. It's like, okay, so now you feel in trouble. Yeah. Okay. So do you feel that in your body somewhere? Yeah. I'm kind of tight in my stomach. And I see your shoulders are kind of hunched over a little more. So take a few breaths and, let's just let that experience be here now with you and with us. Here we are in the therapy. And you notice I'm using the words we and us a lot. So that's part of the way of modeling a collaborative way of being in the therapy. So, together, let's take a look at this. So we might be curious. I'm curious and you may be curious, and let's together look at this. So just supporting moving from the outside in orientation, where the client is looking outside to the therapist for everything, and supporting a little more inside. Oh, okay, well, I'm feeling this right now. Yeah, great. So how are you aware of that? Where is that in your body?
And somebody that don't you all want to have David as your therapist as he's talking? You just your whole body just relaxes. And I think that comes back to, the whole body integrative approach, because for some, I love what you said, Sue, when you said, oh, now I'm in trouble, right? So really being aware, sometimes as a therapist, it's so easy to be able to talk from the cognitive perspective of, I'm noticing you're doing that, and let's help you not do that. And you're giving your control away. And it's so easy to try to teach somebody without the body coming along or really tuning in. Somebody that leans really far red or more preoccupied also can feel very anxious about having more agency, just the idea of holding on to more agency. So as you offer me more agency to stop and think about myself, I'm less in tune to the world. And if I turn down the volume of tuning to the world and turn up my own volume, that raises my insecure attachment response. My implicit history goes, this is not safe.
It violates your internal working model.
It totally violates it. And so it may take quite a while for me to even be able to calm down enough to do that. And along the way, I'm going to feel embarrassed or shame that I don't even know what I want. You're asking me what I want from therapy. I have no idea. If you're not going to tell me, if you don't know, who knows? Oh my God. So now I thought I could trust the world. I can't trust myself, but I can trust you. And now you're telling me to pay attention to myself. And so I love this whole process of it being 3 pillars, and you're really highlighting why we need so many layers, because you slow down with the idea of becoming collaborative in and of itself is a really important aspect of the 3 pillars. That's the first one, right? Like helping people, but to bring how much information processing is involved in helping somebody learn to be more collaborative. The somatic work, you did such a wonderful job of going, so what's going on inside your body as you ask me that question? So it's very, I guess I keep saying the word, it's very integrative and thorough, and so important when we're working with young internal working models to help somebody get in touch with it.
So for the third pillar, the ideal parent figure protocol, what I was noticing is it sounds like it's a shift to just more of a general using imagination. Is that right?
Well, there has been a shift. And this, I think, highlights that the 3 pillars model is an open system. We expect that it will continue to evolve and be different based on the, when it's practiced more and more, and new and insightful and creative clinicians try it out and they develop new ideas. There's already been a few examples of that. But initially, and people who are familiar with the book, the Brown Elliott book, or who may get the book and look at it, you'll see that in that book, which was published in 2016, the 3 pillars were the creation of new internal working models through the use of embodied mental imagery, which we call the ideal parent figure imagery. That was the first pillar. Second pillar was enhancing metacognitive or reflective function ability, second pillar. And the third was collaboration, enhancing collaborativeness. So a few years ago, particularly from the insights of my colleagues in the Integrative Attachment Therapy program and process in Australia, we inverted those. So now the first pillar is collaborativeness enhancement. Second still is in the second position, the metacognition. And the third is the creation of new internal working models using imagery. So in terms of the imagery itself, let me just say, the reason we did that is that it's more consistent with the psychotherapy research, the outcomes research, that says that the relationship is the primary circumstance. And attending to the therapeutic relationship first thing in the therapy process, it's the foundation for whatever else can happen or will happen or not happen. So you want to really pay attention to that as a foundation. And then the context, the perspective taking is also very much a component of that. The psychotherapy research highlights that. And the third pillar is now the specific method that's applied for resolving the attachment and security. Collaborativeness and metacognition, those are common therapy factors that seem to be important in any psychotherapy. Each psychotherapy might attend to them differently, but both of those are very important, regardless of the issue that somebody comes to for therapy. If somebody comes to therapy for attachment and security difficulties, then there's the collaborativeness as foundation, metacognition work, perspective enhancing comes in, and then we specifically use mental imagery. And I'll just give the framework for that as well. In the context of the client going inward, feeling into the body sense, getting out of the head as the center of experience as much as possible during the imagery, coming into the body, feeling embodied, the client then imagines being a young child. Not just pictures being a young child, but really in a first-person way, feels into being a very young child. Perhaps a child who's 1.5 years old. Could be older, could be younger even. But imagines really feeling as a young child in a direct embodied way. Then the therapist suggests, now imagine as the child that you're feeling yourself to be, you're not alone. Imagine now that you're with parents, but as though you're growing up in a different family, not the parents you originally grew up with. Imagine now that you can be with parents who are all the ways you most want and most need them to be to support your sense of security and comfort and safety and being seen and known and valued. Really notice what these new and different parents are like. When that gets set up as a direct, immediate experience, then the client has the experience of getting to redo the formation of the attachment pattern. Being a very young child, experiencing all the attachment promoting qualities that they can imagine these new and different caregivers having. Okay? And we do this over and over again over a period of time in the therapy. And what we find is that not just creates a new and different internal working model that's more oriented with security, it also overwrites or replaces the original insecure internal working model because it's a new and different experience of self as child interacting with adult caregiver. So the power of mental imagery is so rich and so significant that we've leveraged that. We've brought that into the therapeutic process as the third pillar.
So rather than, as you were saying earlier, when it's therapist as a good enough attachment figure, it kind of stays in that mode. And what you're saying is that by bringing in the imagery of the very young self and the young child, it's powerful enough to actually hit the more internal young working model of self as child, not self as an adult relationship with a therapist.
That's the principle that we operate from. Yeah.
Well, and it's got some science behind it. There's been some empirical research that shows, like you said earlier, that you can get better without necessarily changing your internal working model. And this was from quite a while back. Is there anything new on that? It's from a research standpoint that they were really finding that this integrative model actually changed the internal working model, which is what you're saying from an empirical standpoint.
Unfortunately, there's not a lot of research on this. It's clinical experience for lots of clinicians who see this having impact, and somebody may have an assessment, an adult attachment interview assessment, for example, early in treatment, and have that reveal insecure pattern, go through this 3 pillars process, the integrative attachment therapy process, and then we do the AI again, and they can be seen as earned secure. We need some more empirical research.
But there was something, though.
Yeah, there was a study that was published in 2017 by some clinicians in Paris who looked at, I think it was actually 17 people with complex post-traumatic stress disorder. And the focus was not on what the attachment patterns were, but given that they had complex PTSD, it was assumed that they had some form of attachment insecurity. It really wasn't a 3 pillars therapeutic process for the research, but they were given just 5 sessions where they were led through the imagery process, and they were given an audio tape recording of one of those sessions. and they would listen at their own pace in between the sessions, however much or little they wanted to listen to the recording. And then after a period of 8 months, they were reassessed on various symptom measures and quality of life measures. And across the board, the problematic symptoms were diminished, the quality of life scores were enhanced. They were given Carol George's AAP as part of this research. And again, they looked at trauma markers. Again, that was one of the outcome measures that they looked at. And there was a diminishment of the trauma markers in there. Again, this study didn't really focus on the attachment dynamics specifically.
I was thinking of the ideal parent protocol, I believe, because I thought it was in the title.
Yes, they were given the ideal parent protocol for 5 sessions.
That's right. Okay. Yeah. It was just that one element.
Specifically on the ideal parent, the third pillar. So
which is so rare. And it's so rare to have actual
data,
evidence and data that's why I think it really stood out in my mind was, it's always kind of observation, and that can be tricky that you had that. So I was curious if there was more.
So we're continuing to look for resources in order to do more empirical research. None of us are at universities, affiliated with universities. It's hard to come up with the resources to do that.
So each element is really shown to be powerful, and that's what you've integrated in your treatment model, is each element that has really powerful effects, but you just don't have any research on the entire process.
Yeah, particularly the metacognition and the mentalization. There's lots of outcome research on how that can be valuable. But there's the study that we just talked about was the only one looking at the imagery process. But we know through the hypnosis literature that mental imagery can be tremendously valuable and beneficial in all sorts of ways for clinical conditions, for sports performance, for peak performance activity. So we've drawn upon that understanding and that research, integrated it for the specific application for attachment insecurity.
All right, let's take a quick break. I want to talk about our sponsor, Dipsea. So Therapist Uncensored is about the whole person, mind and body, caring for your whole self. And we want to promote you staying awake in a present way. And our sponsor, Dipsea, is one way we have found that you can keep your imaginative and sexual self alive and active all by yourself or with a partner. So Dipsea is an app that's full of short, sexy audio stories. And what we really love is that they're designed by women for women. So it really speaks to a certain voice. And they have hundreds of stories that come alive with immersive soundscapes and realistic characters, whether it's about a second chance romance, a vacation fling, there's all sorts of things in their catalog. And you can search and discover things new about yourself or share the app with a partner or partners and discover more about them as well, because they have new content every week. So for the listeners of our show, Dipsea is offering an extended 30-day free trial when you go to dipseastories.com/TU. So that's 30 days of full access for free when you go to DIPSEA stories.com/TU. So dipseastories.com/TU. Give it a try. It's such a different adventure if you've never done that before. I think that you could get a lot out of it, again, just personally for your alone time or keeping things alive in your relationship. All right, let's jump back in.
So you've gone on from this incredible book to create a course. How did you decide to go in that direction? And can you kind of update us on where you are now with that?
Well, let me just make a reference here and a shout out for our collaborative work. You made reference to this early on about our connections, and based on our enthusiasm for how each of us has similar ideas and passions and interests, and also each of us is different, has similar strengths. Different strengths. Initially we thought we would write a book together, and we started doing that. We were collaborating. It was gratifying, and we discovered that particularly I was orienting toward a little different direction. So you two went on and created this amazing book. It is being published imminently, and that's wonderful. And I went on and developed with two colleagues in Australia, Nigel Denning and Trail Dowie, a training program for psychotherapists. And we're calling it the Integrative Attachment Therapy Training, IAT. And you, based on what we talked about a little earlier, you understand why we're calling it integrative. It's a very, we think, respectful model that draws upon the best of what's out there and also allows our model to change and shift when new and better things come along. We're happy to integrate that integrative attachment therapy process. So one of the reasons that I wanted to do this was because as people were reading the book and more clinicians were learning about it, partly through Therapist Uncensored.
Yeah, we did several study groups actually on it. Yeah.
Yes, that the public was hearing about this too. And we started getting a lot of requests for referrals and a lot of requests from clinicians for, hey, how do I learn about this? I read your book and it's great, but I want some more hands-on training and hands-on work, which of course is important for therapy training. And there just were not enough resources for training everybody and for having enough therapists for everybody. I still get calls and emails every week asking for referrals. And it's very hard for me to say, well, I'm sorry, I don't know anybody who I can refer you to now. They're all full up, the ones who know how to do this work because it's so effective. So this training program, the level 1, which is what we've just released, is an online-based multimedia program that is designed to be self-paced. If people go through all of the resources in this program, in the level 1 online-based program, probably about 80 hours required total, 80. So it's pretty big. And we have text in it. There's a lot of text. Text is based on what's in the book, but it's updated a lot. Again, book was published in 2016, which means it was brought to the publisher in 2015, almost 10 years ago now. There's been a lot learned since then in the field and by us as individual clinicians. So the program is updated. There's a lot of text. There's videos, video lessons where I and my colleagues will present kind of the secret sauce that's in the text, like speaking directly about some of the most important elements and principles. We have audio, we have demonstration sessions, video and audio. We also have a lot of links to external resources if people want to read more or watch videos that are based on YouTube. Tremendous resources out there. So if we're talking about, for example, parental neglect, there are links to a couple of videos, really good videos that highlight what that's all about.
Boy, I saw that, and I was going to say that. So as a user of this course, one thing I was impressed with was it wasn't just the same old.
More.
I mean, it was very engaging and helped kind of keep my interest. We consider ourselves, and I think, pretty well read and trying to stay up to date on these things. So I love being surprised. And I think that that's one of the appeals when I first opened your book. And I'm having a very similar experience with your course. Another thing I liked, by the way, was it doesn't let you just skip ahead. It's like, yeah, I know that. You want to skip 3 chapters or something and get to the heart of the matter or something. And it doesn't let you, which I love. So it's very cumulative. And I thought that was a very, just a sophisticated, important component that really helps you walk through it. But those videos, those different resources, I noticed the Therapist Uncensored episode is in there.
Several.
So that was fun. But that's an example of that's an hour of depth based on the content that you were just sharing. So,
and what you're highlighting about not being able to jump ahead, that can be frustrating for some people initially. It's like, well, yeah, I know this topic. I want to move ahead.
Bowlby, we know Bowlby, yeah.
Right, but we're getting feedback from enrollees, from participants that really, really validate our choice to have it be locked and require people to go sequentially. Similar to what you said,
100%.
We're getting comments like, I consider myself very familiar with attachment in the field, but the way you put this together, the way what you chose to highlight here, it's like I'm looking at it in a little different way now, or a big different way. And it feels fresh and refreshing. And I love hearing that. Yeah.
I feel like that your work really is an opportunity for therapists out there who love this stuff, have been listening, and really can understand how essential it is to look at early attachment and really stop and consider that they have a place to get trained. And it can be in any place in the world. And it's really, I think you're making a very big addition.
And in the study groups that we did, it was the same thing. Remember, I contacted you. I'm like, they have questions. Would you like to come in? And I think that you did an extended group off of one of those groups. So yeah, there's this hunger for this information, which I think is wonderful. And I agree, Anne, that so you went towards training therapists, which is wonderful. And then our direction, we wanted to stay closer to kind of the podcast audience, meaning a mix of therapists and the general public, to make it more widely accessible. So I think that they complement each other so well. Because part of what's in the book are also techniques to help make this complex material, including information processing and implicit memory and all those things, very easy for therapists to convey to a client. It is interesting that, we started, both of these things were huge projects, massive projects. And then here we are launching at exactly the same time. It's really very exciting.
Yeah. And in the program, we highly recommend your book. But we also, in terms of convergence and mutual support, in the section on models and ways of looking and understanding about attachment, we really highlight the modern attachment spectrum that you developed and praise it very, very strongly as a non-pathologizing way of understanding the attachment dynamics. And that's really, really important. And you both communicate that so clearly and so effectively and without shaming in any way. I love how you highlight that people who are insecure in a, say, clinical sense, they can still have secure states of mind. They can still securely relate sometimes in some situations. Now, when they get activated, when there's a sense, when, the amygdala gets stirred up and there's a sense of threat, well, that secure state of mind is going to diminish and they'll go toward hyperactivation or underactivation of the attachment system and have their usual pattern of defense.
As will secure people, right? It's like
secure people go in the preoccupied states. Yeah. Mm-hmm.
We all travel up and down, don't we?
Even if we're secure or insecure, we will have a tendency toward a particular place on the spectrum. We'll have a center of gravity. Ideally, that's in the secure range, in the green zone, as you highlight. But stresses impinge on us all. And even if, our central tendency is in that green zone, we can shift toward the blue, or we might shift toward the red. And if we're, relatively stably in that green domain and zone, well, we'll probably get back to that more quickly, or we might not go as far into the spectrum. A little more resilience and a little more recovery capacity. But that's just normal. And I love how you communicate that.
Thank you. I think that's something we so have in common. That was one of the draws towards one another, I believe, because it's very easy to get really scared when you start looking at neuroscience and the permanency and the us, them. But I'm imagining the listener right now, and they're excited about your course. Like you said, this is level 1. And I want to mention now, and we'll mention again at the end, that of course we are going to partner. And for those therapists out there that are listening, sign up through our show notes page, which is going to be therapistsuncensored.com/TU2. What was the number of the episode?
234.
234. TU 234. And that'll take you right to the show notes page. And then the link will be right there for you to sign up for this course with a discount. And David, thank you for extending that to our listeners. It's wonderful. But just going back real quickly, so this is the level 1. And then what else do you have in mind? What's going to be happening?
Yeah, so level 1 is the foundations course. Gives the background, the cognitive, valuable information, and presents the therapy process through description and also videos and audios so that people can really get a sense of that, of all 3 pillars. So it's a comprehensive foundational resource. And because for clinical training, it's valuable to have much more direct in-person practice, there will be levels 2 and 3 as well. Those will be live trainings. So the level 2 will be a 3-day workshop, live workshop. Level 2 is for people who've completed level 1 and want to continue. Level 3 is for people who've completed level 2 and want to continue. Level 3 will be a 2-day workshop plus, I think, 5 group consultation supervision sessions and 2 individual sessions. And if people complete and satisfactorily demonstrate ability, then they will sort of graduate into the capacity to be, registered as an integrative attachment therapist in our particular approach. Let me say here too, one of the reasons that we wanted to do this was that because the ideal parent figure imagery process, it really is effective, and it's kind of new and unusual and not so hard to get the basics of. So a lot of non-therapists, actually, people who haven't trained as therapists, have been applying this, have been offering this, have been saying they're ideal parent figure coaches or ideal parent figure facilitators. And there are YouTube videos put out by lots of people, saying, we're guiding you through the ideal parent figure imagery. And Dan Brown even has one on there, which, he put there many years ago, just as a generic demonstration of that. It's gratifying that there's a lot of interest in it, and I'm sure a lot of people are being helped by it, even when it's presented by a non-clinician. But the problem is, for people who have more problematic conditions, psychological, mental health conditions, if they're not with a therapist who's been trained in holding the space for somebody with, say, a personality disorder or post-traumatic stress disorder or complex PTSD, everything may seem fine, but the imagery itself, being engaged with that might lead to dissociation, or might lead to a flashback, or might lead to a reactivation of some addictive problems. If the person is not a therapist, the person won't know what to look for, as the danger signs, the warning signs of that, and won't know what to do in response to help that person. Frequently, I get contacted by people who've been in this circumstance, by clients who said, hey, I was working with someone with the ideal parent figure, and then I started dissociating and having nightmares every night. The person didn't know what to do, so I'm calling you. Too many of those circumstances. So we want to train more clinicians in this approach.
And consumers beware, know what to look for. Yeah. So it seems like it's going to be a little while, though, since this is just starting to actually have your registry up and going. Is that right?
We've got a number of people now who are fully qualified, but we don't have the website up yet that gives those people's names. We're worldwide. We have people in various countries who are qualified now, but they're all full because there still aren't so many of them. And gradually, as people take the level 1 training and then go through levels 2 and 3, that list of people who have the capacity to work in this way will increase. And we're fully welcoming of anyone who maybe identifies as a somatic psychotherapist, focuses on sensory-motor psychotherapy, for example. We don't expect people to say, okay, now I'm going to just do integrative attachment therapy. But if people who've been trained in other models and methods and approaches want to say, well, I do this approach and I've trained in IAT, so I, when appropriate, can apply the 3 pillars in this particular way. And then when it's not necessary or not appropriate, well, I can draw from what else I've learned from and trained with.
And I love that you're forming a community of people who really feel motivated and inspired to work from this direction. Like you said, once somebody gets certified through the model, then they have access to being put out there and, joining in such a sense of a community to build on this.
Yeah, that's an important piece of it too, because I referred earlier to the collaborative aspect of the process or the training itself. I'm thinking of one in particular, a person that I've trained who has become quite skilled at this, and he brought something new into the model. We, in the imagery process, when we think about how the imagined parent figures will be in terms of, ways of being that support attachment security, we have 5 conditions that promote attachment security. We've drawn from Mary Ainsworth's maternal responsiveness category that she highlighted as foundational for the development of security in most children. And based on her work and research and other people's research, we've developed this list of 5 primary conditions: providing protection to the child.
Oh my gosh, I have this memorized. I think so, because I use the acronym PASSED, PASSED. I think if this is a protection, attunement, soothing, security, something. ED was, hold on, don't tell me. Exploration
No,
and self-development. It was in there somewhere.
Well, PAS,
right?
Then E, as you said, but E is expressed delight.
That ED. I kept saying ED.
Okay.
Express delight. That's
Yes.
right. Which is such a lovely one.
Yeah. And then the last one is
that's the one with the exploration.
Support for exploration and discovery. Yeah. One of the benefits of looking at it in this way is that, the first four are all ways that the parent is to, provide, something that's relational for the child and a positive internal experience for security. The last one is encouraging exploration and discovery, actually encouraging moving away from the parent figure so that the self can have new and different experiences and can grow and evolve in that way as well. But anyway, one of my trainees, he now, in addition to having the parent figures engage in these 5 conditions that promote attachment security when the client is imagining being a young child, he also sets a context for play. Imagine now that you're in some setting where you're really getting to play freely, and these parents are encouraging you and supporting you. So this really draws from Winnicott's highlighting of how important play is for a child and what problematic things happen if the child doesn't get encouraged and have the opportunity for play, and what can really benefit, what benefits come when parents are able to promote that and encourage that. So he does that in his imagery with people now, and really we're integrating that more into the system as well.
This notion again of collaboration. Our book is coming out April 30th, 2024. And one of the premises is this idea of creating secure ripples so that it's a counteraction to this despair of polarization, this contagious, giving up that is happening, or in tribalism and the teams that are forming. And you are somebody that has been certainly working towards building these secure spaces and letting those ripple out for sure. I think that's part of why we were drawn to each other. But I also want to mention you're going to be at the virtual launch, which is May 1st, along with some other people. Have you seen the list?
Lots of amazing people.
Who are you excited about seeing? Do you remember any of them?
Oh, Alan Sroof, certainly one of them. Yeah, Carol George.
Yeah.
And you said Dan Siegel might even be there.
Dan Siegel said he has somebody in town visiting. It's on his calendar. I don't know if he's coming, but he was very supportive.
Stan Tatkin and Kristen Neff are going to come.
Lori Gottlieb, Linda Tai, Liz Plank, really interesting. And other guests of the podcast that have been on before that our listeners love. And we just, again, it's like this notion of building community. So we are so beside ourselves excited about the community support of the launch of this book. Then we also want to support everybody there. Everybody's going to talk about, your latest and greatest. And we're going to create something that will give to all the audience members that updates them about what everybody's doing, So in this mutually supportive, collaborative way, again, that we're launching in community. I mean, I want to just pinch myself. We wouldn't have ever imagined such a show of support and a perfect example of coming together as community, because also the audience is drawn into this book for their reasons, right? It's like a siren, not the book itself, but these messages that we're talking about around building security and building that muscle of hope and being able to do something instead of dissociating and giving up or joining on the bandwagon against the other out there that is freaking us out and that we're told will threaten us, whether it be a party, political party, or populations of people, immigrants, whatever it is that we're being set up against. So that's a long way of saying and mentioning again the virtual launch May 1st. And you've been so supportive through our writing process. And you were the first person that stepped up and gave us a little blurb to just have something that we then built upon. And you just can't say enough appreciation about that.
I just want to echo everything that you've said. A big shout out to Sue for a lot of the work around the launch and the idea about the launch. And I guess I'm going to have to throw in just that one echoing of the secure relating concept. Like when we were talking about the collaborativeness and that being the first element, I love that moved to the first element of the pillars. I really liked that transition. And I really see, as what you're saying, is that that's what we're all trying to do, is to help the world become more collaborative, because that is the first step no matter what.
You're so right, Anne. Moving back into collaboration, out of certainty, out of divisiveness.
And into, if we don't all as a community, not just the community that's going to be on the virtual launch, but as a community, not focus on, if we can center on collaboration before anything else, and we can center on coming back into the middle and to secure relating with one another and the challenges that we need to do, whether it's standing up and finding our ability to have a voice, or it's recognizing that we don't let anyone else in because we think we're right. Like that, both of those are the contribution, and that we need to like integrate and find our voice as well as listen to others. And that is what this is all about. So that's what we're going to be celebrating when we do this virtual launch. And that is what we really hope our book has the biggest impact on. We cover individual and relationships, but we also then end with society, because that's, a real passion.
That's right. SecureRelatingBook.com. And what about your contact information, David? How can people find you?
Yeah, well, the website that describes level 1 is integrativeattachmenttherapy.com.
Integrativeattachmenttherapy.com.
Yep, all one string, yeah.
And you will find that in our show notes, so you can quickly link to that in our show notes too.
And just in terms of integrative, I want to highlight that your book is just beautifully integrative. You have brought in the neuroscience, the clinical phenomena, the non-clinical, ways that this gets represented, the individual, the relational, the group, the societal, the collective. You in such clear language and with lots of great examples, make this clear to people, much more than I could do. That's one of the reasons I probably went off in the more training program for clinicians development. But what this book is unprecedented. It's definitely going to make a huge impact, not just in the field of attachment, but I think in the society at large. And I'm going to be a champion of it as much as I can.
That means a lot.
It's such a good pair. This course, our book, you'll be set. You'll be all set.
Thank you so much for joining, David. It's so much fun to see you. And
Great
I am, Sue, Sue and I can say that we're just so excited about the work that you're doing, and we want to continue to collaborate in any way we can.
I'm happy about that. We will, yes.
All right.
Thank you so much.
And don't forget, sign up through our website. There'll be a discount code there, and find out more.
All right.
Check it out.
Thanks so much for joining us today, and we'll see you around the bend.
Therapist Uncensored is Ann Kelly and Sue Marriott. This podcast is edited by Jack Anderson.